Okay, we're continuing with the book here, Prevent and Reverse AFib and CHF by me, Pete Rogers. We're on Chapter 7, Hypertension. It's page 107. Okay, so the first question is, what does conventional medicine have to say about hypertension? And I just spoke to some medical students not that long ago, a couple months ago, and they're like, is it correct that 95% of hypertension is essential hypertension? You know, idiopathic hypertension. Idiopathic means the doctor's an idiot and the patient's pathetic. Of unknown cause, they call it essential. And this is the absolute same nonsense I was taught back when I was in medical school, which is a long time ago. I was back in medical school 35 years ago, okay? And they taught us this nonsense. And when you're young in med school, you don't know anything. You just believe whatever you're told. Okay, and so conventional medicine says nobody knows what causes hypertension. It's impossible to cure it. We just give them a pill. You know, typical conventional medicine. Match the ill to the pill, send a bill. They say the same thing for diabetes. The same thing for coronary artery disease, atherosclerosis. The same thing for dementia, gastroesophageal reflux disease, peripheral vascular disease, PVD, you can call it PAD, peripheral arterial disease, brain arterial disease, bad, I made that one up, DJD, degenerative joint disease, same thing as osteoarthritis. They always tell you they don't know what causes it, which is perfect, or they say it's genetic, because that means if you don't know what causes it, the way to treat a disease typically is to avoid the thing that causes it. So if you don't know what causes it, then you don't know what to do except take their pill and try to slow it down, okay? And so that's how the typical book chapter is on all the chronic diseases in the conventional textbook. They say, well, we know it's associated with aging. Yeah, no shit. Old people get sicker, all right? Then the next thing they go, well, sometimes it's part genetic. Brilliant, okay? Then the next time they go, for some disease, they go, well, this might be associated with an infection, perhaps a slow virus of some sort. Brilliant, okay? It's always some bullshit that you can't do anything about. And then here's the other one they throw in, just a little guilt trip. Well, maybe it's socioeconomic disparity because of you evil racist piece of crap. This is all nonsense, absolute nonsense. They're not nice. They're pretending they have the moral high ground and they're thoughtful and they're scientific. No, they're lying scumbag assholes, okay? This is evil, dishonest crap, all right? All right, so let me just show you the truth of what this is all about. All right, it's just a way to sell drugs, okay? And then you say, well, how could I be so confident? How could I speak this way? Because it's obvious. Anybody that studied this knows it's obvious. Walter Kempner would cure all his mild to moderate hypertensive. He'd even cure some of the severe ones in the mid 200s, okay, with a low-fat vegan diet. Nathan Pritikin, John McDougall with low-fat, vegan or almost entirely vegan diets, they'd get 90% of the patients off their hypertensive meds, all right? And the other ones reduce them. And they could do it fast, within a week or less. Hypertension will often take longer to come down because the blood vessels have been under disease for decades and decades. They've lost the Windkessel elastic recall fibers in the ascending thoracic aorta. My voice is a little hoarse because I was talking on the phone a lot recently. I had a friend of a friend had a medical problem, and I was just talking to him. Okay, let's see. Old-fashioned populations that eat plant-based diets, they don't get hypertension. And here, I'm just going to show you, I'll give you an example with black people, okay? Black people have very severe hypertension. They've got about the worst hypertension of anybody, okay? And then, the textbook, tries to be thoughtful. And what I was taught in med school is, look, black people got a lot of hypertension. It's thought to be genetic, probably salt sensitivity, coming from a hot climate in Africa. There's nothing you could do. What are you going to do? Just try to reduce their salt, but there's nothing you could do. Okay, so let's look at reality here. Here's a research paper from, it was made in Kenya, in Africa, back in the year 1929, Lancet Journal, author C.P. Donison, a guy from England. Blood pressure in the African native. It's bearing upon the etiology, the cause of hypertension. All right, so these are all adult black men in Kenya. And what they did was they took 1,800 consecutive patients, adult black men, admitted to the hospital and checked their blood pressure. What percentage of them do you think had hypertension? There was no case of raised blood pressure encountered. Not a single patient. Zero. That's what I'm trying to say. That's how powerful a low-fat vegan diet is. You put people on a low-fat plant-based diet, no one gets hypertension. The incidence is zero. Okay, that's why I mean when they tell you it's idiopathic 95% of the time, nobody knows. That's horseshit. It's obvious. populations where they eat low-fat, plant-based diets, they don't get hypertension. And it's not just in Kenya. It's everywhere where they eat this way. It's not genetic. That's all BS. Okay, there was more in this study. They also took a group of men from Europe and a group of men from Africa, where the Africans in Kenya were eating a plant-based diet. The Europeans eating a westernized diet already of that type in that day, with meat and bread and jam and all that. The average blood pressure amongst the white Europeans average of 60 years of age was 140/90, so mildly hypertensive. The average blood pressure in the adult Kenyan man of average age 60 years of old was 105/67. Same as a teenager, little kid. Perfect, okay? So it's not genetic. That's all BS. You need to know that, because once you start understanding that this low-fat vegan diet it's not like a little bit better. That's why also people say, oh, why don't you debate this paleo, keto, carnivore, lying piece of crap, this high-fat, phony, lying piece of crap? Because this stuff has already been figured out. To be quite frankly honest with you, it's a little bit boring for me. I read all the Kempner and Pritikin and McDougall and Esselstyn and Burkitt and Campbell, okay? I'm kind of bored of all this stuff. You eat low-fat vegan, you don't get these diseases. What more could you want? And that's why I tell you McDougall's the best doctor in the world that ever lived, because he cured all these patients. The cure rate in conventional medicine is 0, none, nada, ninguno, okay? Whereas the cure rate with this is like 100% just about. But you got to get to them fast. Once they've had hypertension for decades and decades, there's so much damage to their arteries with, calcification of their ascending thoracic aorta and even their smaller vessels that you're not going to reverse it. You'll improve it a lot, but you won't reverse it completely. Okay. In the USA, if you took, all these black men admitted to a hospital, 80% of them probably would have been hypertensive. Okay. All right. So that's all we're going to cover for today. So now you know there's hope. There's great reason to be hopeful if you're willing to follow the diet. And most people aren't. About 95% of patients in my experience, they won't follow the diet. They're going to say something like, I'd rather die than stop eating meat. Well, go ahead. That's what you will. Have fun being fat, sick, and stupid like most people. If that's what you want, go ahead. I don't care. It's your life. But you give them a chance. That's kind of how I feel about it. So anyways, that's it for today. I hope you found it helpful.